All right, team, we're going to talk about animation deformity. This is super cool because this is something you've seen us do a lot of surgeries recently, and I think some of it has to do because patients are so fit, they're thin, and we're going to show you why people get this, because this is actually when the muscle flexes, you see that implant moving. A little bit of movement is okay because that's how the muscle massages the implant, keeps it soft, but if it moves too much, it sometimes can be disturbing. Why do we get it? You know, typically the implant is underneath the muscle. Oh, I got you on erase, so let me put you on marker here, highlight, nope. Boom, there we go. Oh, I think I got it. I promise I know how to do this. There we go, boom. Implant underneath the muscle. So there's our implant. Here's our muscle over the top. A dual plane releases some of that muscle so the implant sits perfectly behind the nipple, and that's what's going to give it the nice shape. That's when we talk about settle, and implant settles, and that nipple rotates up just a little bit. The problem becomes when that muscle comes up and then kind of lampshade. So then it goes up, and when it contracts, it can actually cause a line in the breast. It can shift the breast. It can make the breast look a little bit off, and that can be concerning to patients. And so when we get this muscle that's going a little bit higher or higher like this, then it's not covering as much of the implant, so we're losing some of the benefit. And then when it contracts, you can see how that could cause an indent and shaking of the implant. So how do we treat this? You know, one way is to get this muscle to stop moving. That involves some complexity of going after the nerve. The other is to put the implant above the muscle. We used to avoid that because of the saline implants causing a lot of rippling, being a lot firmer. The new gummy bear implants give us a little bit more room to play. So we can actually take the muscle that we have here, put that back down, and then put the implant over the top. So we gotta lock that muscle down, put that implant in a new pocket above. That also helps treat when the implant has been out of position a little bit to restart that from fresh. So animation deformity, you're welcome, treat it, bye, see ya.